welcome to Hatching for Health with your host, Jessica Hatch. Tonight's episode, we are going to be joined by Dr. Justin Chronister. He is an orthopedic surgeon here in Houston, Texas. So thank you so much for joining us.
Thank you, Jessica.
Yeah, it's great to have you here on set. I'm used to seeing you in scrubs in the clinic.
Yeah, we sometimes we can dress up.
Yeah, nicer little change of pace here. So tell us a little bit about you as a doctor and kind of, your schooling in general. I know orthopedic surgeons here in Houston have come from a lot of places around the country and some even, moved here from internationally. So tell us about kind of your story and what got you started.
Sure. I mean, I actually grew up in Houston. I went to college in Austin, went to the University of Texas, came back here to do medical school and my residency training. After college, we do a 4-year medical school program, and through that process of seeing different fields, you choose what you want to do, and that dictates kind of what residency you go into, and all those are different lengths based off the amount of training. Most surgical residencies are 5 years at least. Okay. And then if you want to do a fellowship like I did in sports medicine training, then you go do another year. So I've spent most of my time here. I did my fellowship in Alabama with Dr. Andrews, but came back after that year and started my practice.
Okay. So after your 4 years, like the bachelor's degree, then you go and do another 4 years. And then that 5th year is usually tied to like if you're going to be doing surgery?
No, so you do another 4 years of medical school.
Okay.
And then you do another how many ever years of residency on top of that, and that's the actual training. That's where you're getting in there and you're doing the surgeries, you're doing the clinics, and my specific one for orthopedics was 5 years.
Oh,
so
okay.
5 years on top of the 4 years.
Top of the, yeah.
And then another year on top of that for the sports medicine fellowship.
Okay.
So overall 10 years of training after college.
Yeah, that's quite extensive. And were you an athlete growing up? Was that partly why you wanted to go the sports route?
Yeah, I mean, that ended up factoring into it in the end. I think mine was stepwise. I actually went to college or University of Texas doing mechanical engineering, and so completely different route.
Yeah.
And despite contrary belief, I did a couple internships and realized that desk work and looking at numbers all day is not that fun.
Yeah.
And so I kind of changed directions towards the end and realized I like working with my hands and I like biology, and so I put together, I want to do medicine, I want to be a surgeon.
Yeah.
And when I got to medical school and I started feeling those out, and you get some experience going and watching some of these surgeons, I realized that mechanical engineering and orthopedics are very much alike.
Yeah.
And so it kind of directed me towards orthopedics. And then as I'm going through orthopedics, you got so many different specialties. I mean, you can have people that only deal with broken bones. You have people that deal with replacements, kids, all these different specialties. But sports, to me, was something that fit in with my sports enthusiasm growing up and playing through college. I even tore my ACL playing flag football in medical school, so that laid into my training. But I put in sports. But sports is awesome too, because you get to be very general. So you can be specialized and have an interest in sports. You can try. You can do the low invasive arthroscopies, joint preservation surgeries, but also treat fractures, treat kids, treat adults, do the procedures that when you can't do the joint preservation, you need to go to a joint replacement. So I do those as well for the shoulder, knee, and hip.
Okay. Yeah, because you do upper extremity, lower extremity, and how does that play out? Like whenever you go and say, okay, I'm going to be an orthopedic surgeon, I want to focus even on sports specific. Do you then even say, I want to only learn upper or only lower, or is it always, both?
There are some. There's some out there that are very, very specific, knee and hip. There's some that are upper extremity. There's some people that are hand and wrist.
Okay.
Some people want to really narrow it down. Other people get a training and they can keep it broad. And mine's pretty broad. I mean, I'm very interested in sports stuff, and a lot of people don't do the arthroscopy, so that's where my specialty comes in. I do things through the poke holes and minimally invasive. Yeah. Well, it's nice because people get to recover faster. We get to treat things without having large incisions. We get to preserve the joint integrity without jumping to a big surgery. And so that's where mine comes involved. But I still see shoulders, elbows, hand and wrists, hips, knees, ankles.
Yeah,
I even see back pain. I don't operate on it, but I focus on knees, shoulders, and hips are probably the mainstay of what I do. But anything from joint preservation to joint replacement.
Tell me about that type of surgery, the arthroscopy.
Arthroscopy, yeah.
Because it's minimally invasively done, and so you're not like kind of completely opening.
No,
exactly.
yeah. So I mean, it's been around for a while. It's gotten better and better as we go, and we get more and more minimally invasive.
Yeah.
You know, at one point when we were treating rotator cuffs, we may stick the camera in there, look around, and say, "Oh, there's a tear. Let's open it up."
Yeah.
Now it's extremely rare to have to do that. So we make a few poke holes around whatever joint we're working on. Use a camera inside one of the holes, and you go through another hole with a tool, and you can do whatever you need to do through those openings. You know, you can make a third one to tie knots to hold the tendons where you want them to be if they've torn.
A lot less invasive.
A lot less invasive, so the recovery is quicker.
Yeah, it sounds like it. So how have things been, just with this, I mean, we're kind of like we're coming out of COVID, but how has that affected, surgery? Did you guys get a lot of cancellations, or, I mean, just in general, like with the hospital, I know everything is...
Yeah, so I mean, we've had to roll through the different phases. Early on with COVID, everyone shut down. The hospitals were shut down, our offices were shut down. Quickly after that, we realized that we can't shut down the office. We may not be able to have the surgeries, but there's people that are hurting. There's people that were post-surgery that needed to get in, and they just didn't know what to do. So, we opened back up the office. We tried to precaution as much as we can and make sure that everything's sterile. We're all constantly cleaning. People are sterilizing their hands. We're wearing masks, and we eventually got back on track. Yeah. Now, as far as volume goes, it's been pretty low just because people were afraid for a long time. But that's started to improve a few months ago, and then the hospitals have shut down a couple of times, but that's based off of what their infection capacity is. If they feel like they're starting to have too many infections, they need the staff for that, then they'd shut down the OR or at least elective procedures first. Now, I've been doing emergency stuff all the way through. I still take fractures and call stuff, so those have to be done. You can't wait on those. And so we haven't shut down for that, but some of the elective stuff has shut down a couple times. But we're up and going now. I mean, the hospitals are looking pretty good now.
And that's, so right now you have 2 locations you practice out of. You've got one in Memorial City and then one in the Heights.
That's right.
Okay.
That's right.
And then you are part of a few different hospital systems, I'm assuming.
I am.
So when you say take call, is that tied to like certain days of the week that, at any point you could be called to?
Yeah, it's random. We mix it up with multiple people at the facilities, but there's a call schedule, and if there's someone comes in, let's say with a hip fracture or a lower extremity fracture or something like that, then we got to manage it when needed or fix it for them when needed. Yeah. And so that never stopped. We had to keep doing that, but again, the ORs are now moving. COVID numbers are looking pretty good lately. Yeah. And so we're doing all the surgeries now.
And so for obviously with Hatching for Health, I mean we bring on a combination of different folks. We do have a focus with children and helping children, whether it's related to a condition they were born with that there is a cure or there's not a cure. But you do operate. As to what age, I guess, where does it start?
So typically I see patients down to the age of 4, because these are patients that are children that will have injuries. Even if they're not in sports, they'll have injuries. They can fall, break a wrist, break an ankle,
of course.
Need sometimes the surgery or casting, be evaluated in clinic. And then above that, you start getting kids who are in the sporting age, who have higher activity, and they end up having injuries from that. And that can usually ranges from sprains, something mild that treatment-wise can be a little bit of rest, maybe some icing and anti-inflammatories, potentially if it's bad enough, some immobilization for a little while. But then you get into the higher level where you get ACL tears, shoulder dislocations, separations, repetitive injuries like throwers injuries in the elbow where they may need a surgery. And so that's where we come in, we can evaluate it and potentially need to be fixed to operate to be able to go back to the sports.
Of course, because this is, you're, being that you are, listed as that sports type orthopedic surgeon, you're going to get, probably mostly when it's children related, like little athletes that are, kind of up and comers, and you want to get them right back on the field.
That's right. I mean, there's so many different levels of these kids, and then kids that are just out there for fun and they can have injuries, and then kids that are really seriously out there and through high school years that are looking to go to the next level. They have injuries too, and that actually brings up a good point, because some of this stuff is based off, our treatment options are based off their competition level, and sometimes it's based off of what time of the season they're in. If someone's dislocated the shoulder, and we can just keep it in until the rest of the season, and then fix it on the off season so that they can come back during the next season and not miss any time, then that's one of the considerations we try and look at.
Of course. And that's, obviously too, based on what the individual is their comfort level, because that can be obviously very tricky, like putting something back into place temporarily.
One of the tricky parts is the parents. There's some parents that are like, let's get them back out, and then there's other parents that are so apprehensive about it, like let's just shut it down and never play again, kind of thing. So it's all over the board. But my goal is to fix them where they don't have recurrent injury, don't have long-lasting effects, and that they can get back out on the field as fast as possible.
Yeah, I mean, so I guess some of the advice maybe to young athletes to just prevent sprains and and broken bones even. I mean, is there maybe some prevention tips that you would have for them?
I think there is, and for the parents, I think the easiest step is the things you can control, which is going to be make sure you have the right equipment. Make sure it fits. Sometimes we have brothers that wore something and we pass it down. And maybe that's not the best idea, because you want to make sure that the equipment fits, it's sized appropriately, and that can prevent injuries. The next one has to do with more coaching, and has to do with the practice, because it's going to be the appropriate techniques in some of these sports, the appropriate mechanism when you're doing some of these sports, especially in things like football, where there is contact. You want to make sure that the training is good, and that the kids have time to practice these, so they don't hurt themselves doing it. So I think it comes down to just doing things appropriately and making sure that they're wearing the appropriate stuff.
Yeah, definitely. We do have to take a commercial break, but I want to talk concussions when we come back from the break. So we will be right back with you after this break. Imagine hearing the news as a parent that your child has been diagnosed with a condition that is degenerative or life-threatening. Now imagine being told that there's little to no research for the condition that even exists, making it difficult to try and figure out what to do next. The reality is that for so many rare conditions, finding specialists who understand the condition and being able to make informed treatment decisions for their child is very challenging. Each episode, I will help with my network of physicians and medical resources across the U.S. to attempt to connect the dots by bringing widespread recognition of rare conditions and connecting families to the best treatment, clinical experts, resources, and support. I'm going to highlight these hard-to-diagnose diseases and offer in-depth awareness for families of children in the rare disease community. I believe we are all in charge of our own healthcare, and pushing for answers and creating awareness for these various rare health conditions can make the world around us a better place. Not only am I a huge advocate who seeks to spearhead the fight to bring rare conditions to the forefront of research, but I personally had my own rare condition. In this rare condition, I was able to be cured of due to early detection. My passion to help others was fueled by that experience, and it has led me to start the Hatching for Health show. Now, this show is a vehicle for us to create awareness to help these children find cures. Hi, I'm Jessica Hatch, the host of Hatching for Health. We are a show that was brought about to create awareness for children with rare diseases, disabilities, and disorders with hopes of finding cures. We are looking for doctors that would like to participate in being on our episodes and possibly even bring their own patients on the show to talk about how they have helped cure them whether it's been surgically or through medication or any sorts of ways. We think that it's very inspiring for others to learn these stories and to possibly help somebody else. So I encourage you to reach out if you are a doctor who is interested in being on the show and allowing us to highlight not only you, but the work that you've done for a child. You can reach out by emailing at info@hatchingforhealth.org. That's info@hatchingforhealth.org, and we look forward to hearing from you. Welcome back from the break. If you just joined us, we have Dr. Justin Chronister here. He is an orthopedic surgeon here in Houston, Texas, and we are talking about a variety of things as it relates to sports injuries. And what we were talking about before the break about kind of some ways to prevent it and some advice to give to parents. And I know we talked about, some of the things with sizing, making sure they're, not just throwing on the glove of their, younger or older brother or sister, but making sure it really fits just right, but also, just the training. And I think stretching too, what you were talking during the break, that's so big, right? Like making sure you're, limber.
I do. I think that, we focus on the strength training and kids get into that. They get to get in the gym and push some weights around. But I think the flexibility is really what prevents the injuries. Majority of these injuries are sprains, and they're going to be a mild or moderate sprain. They're not going to be something that needs surgery, but it's because the ligament was tensioned past what its flexibility was.
Yeah.
So flexibility and all on top of the strength training is very important to prevent these injuries. So if you roll an ankle or something like that and you're tight there, then it's gonna stretch more than it wants to. But if you're flexible, then it'll have that capacity to stretch a little further and won't cause injury.
Yeah,
so very important.
A lot less likely of them. What about concussions? I feel like this is very important, obviously for all parents. What are some of the signs of concussions?
So I think concussions are very important nowadays, and it's become much more important over the last 10 years or so. We've become more aware of the effects of it, or long-term effects of it. And so basically concussion is a brain injury from a hit, a jolt, or even a shake, something where the head whips real quickly and it causes the brain to joggle inside the brain and potentially bruises it. And so the tricky part about concussion is we think of this thing that's really severe, really bad, and it potentially needs an emergency, and those are there. But sometimes concussions can have very mild symptoms that stay mild, or mild symptoms that actually grow over time. So you have to be very cognizant of some of these symptoms, and it can be something from a mild headache to potentially having just slight memory loss around the injury that you wouldn't think of as a big deal. It was just the hit, or they got their bell rung, is what we call it. To being a little bit confused. Now those can grow to bigger issues of having a lot of confusion or agitation, or being fatigued, weak, or unarousable. And in some cases you start getting slurred speech or nausea, vomiting, and whatnot. And so some of these are danger signs, like the slurred speech, the nausea, vomiting, loss of consciousness, becoming unarousable, and those actually need to be evaluated immediately.
I can imagine. If you feel as though a concussion might have happened from some sort of impact, or the various ways you mentioned, what's probably the important thing to do to go to your regular doctor, urgent care, or what?
So there's kind of different levels, and the number one point out of all this is if you suspect a concussion, and sometimes there's not football usually has a trainer or a doctor out there that's been trained in it to evaluate the child, but if not, the coaches and the parents need to be very cognizant of this. If you suspect concussion at all, the kid cannot go back on the field. It's just they cannot go back on the field, because sometimes a second hit can cause a very severe increase in those symptoms. So do not go back on the field until you've been evaluated, had the appropriate treatment, and then been evaluated again and been cleared. Okay. Now, so for when we have an injury on the field, there's a evaluation that we do. It's called the impact, and you can find this on the CDC website. It's a few questions to figure out, what the kid's cognition level is there some symptoms of it as confusion? Do they remember the team they're playing, the score of the game? Is there some are they acting funny? Do they seem like they're all there? Do they seem dazed? Is there any functionality weakness in them? And we do this on the field. And if that's negative, we can potentially put them back out. If we think, hey, they haven't had a concussion, they just got hit hard. But if there is any signs of that, we got to pull them off.
I see.
Okay. And then at that point, there's another action plan. It's called the Heads Up, and you can find this on the CDC website as well too. And this is more for the coaches and the parents. And what this does is say, hey, this kid has a concussion, likely concussion. This is what you need to look for. This is what you need to do, what you need to not do, how to start treatment, and really how to get follow-up, and how to have this kid be progress to where it goes away, and then they get to come back. But it's a good resource for parents to have, and to coaches to have as well.
And that one is called
the Heads Up
the
Action
Heads Up
Plan.
Action Plan. Okay, and I assume a lot of the sports trainers probably have that in their back pocket as
likely
as a you know.
I think some of the risk is some of those ones that aren't football, because football is so monitored nowadays. But you still have soccer, you still have potentially basketball, or even baseball, softball, where there are heavy impacts that still occur. In these, you get a head-to-head impact, and you think, oh, it's just soccer. Well, it happens, and it can cause a concussion. So the coaches have to be very aware of this, and if the parents are there, they need to make sure they're very aware of this too.
Of course. So one of the other things I thought was interesting, just kind of talking offline, is I know in your earlier work of being a doctor, you were actually a part of a group called Operation Rainbow. So I think, again, going back to why we're here on the Hatch and Farrell show, is we are here to help others to inform them of things related to what their children can do to obviously improve their health, or prevent injuries. But this is a unique organization that you said 12 times out of the year, which is once a month, you've got a variety of doctors going to help children with orthopedic surgeries. So tell us about that.
So Operation Rainbow is a great organization. It's been around for nearly 40 years now. Obviously, I haven't been doing it that whole time, but it's been around, and it's put together where it's orthopedic surgeons, pediatricians, medicine doctors, anesthesiologists, and nursing staff. And what their mission is to pick areas of underserved areas and children who might have orthopedic issues, might need to be seen by an orthopedic doctor, and they don't have those resources there. And so what we do is we set up about 12 a year. Now, it hasn't been going the last year, but about 12 a year. The plan is to get these people together, to get the money together, to get the facilities together, and plan with the local and state officials, and we get to come down there, and we set up a clinic for a few days, see hundreds and hundreds of kids and their families. This could be anything from recent fractures to fractures that may be subacute but haven't healed appropriately, to knee pain, shoulder pain, any kind of orthopedic issue. And we do clinic for a few days, and people that we can treat without surgery, we do, and we give follow-up to the medicine doctors that might be there, so they know what to do next when we're not there. Or we plan them for an operation. And so for the last half of the week that we're there, we just operate all day long and fix these kids. And for a lot of these people, it's still arthroscopic procedures that we need to do, but some of them it's stuff that needs to be fixed with hardware or plates and whatnot. And we actually bring those with us. And we get some donated, and some is honestly it's stuff we've used on others, taken out and re-sterilized to bring down there. But you got to use what you got to use. So.
Yeah, because this is a non-profit, so it's nothing that you're expecting these families to actually come out of pocket for. It's solely on a volunteer basis, and just hoping that you have everything, which it sounds like you guys do. You come quite prepared to be able to solve whatever issue. So it's a whole week. The beginning is all the consults.
It's 6 days.
Intense days, I bet.
Yeah, it's a lot of work. We're there long clinic days, long OR days. You feel like where are these injuries coming from? You say, well, how are we going to get 50 surgeries and 50 to 100 surgeries in 3 days, and it just happens. There's so many people that need help that haven't gotten the help they need. The nice time is we get the last day for ourselves wherever we go. I've been. It's good places. The plans are usually to somewhere in Latin America. I've been to Dominican, I've been to Honduras, I've been to Ecuador for these. They've done some outreaching to Africa in the last few years too. So it's just really areas where these kids cannot get it.
Underserved and don't have that access to care. So how many of the, like on the orthopedic side, come along? Because I know you mentioned a lot of different.
Usually, They're usually about 5 to 10 doctors.
Okay.
Usually about 5 to 10 surgeons.
In addition
that
to the
come along.
anesthesiologist
In
and
addition,
the general. And,
yeah, that's just the
okay.
surgeons.
Oh yeah, because I'm thinking like, to accomplish that many surgeries in that short of time, you need quite a bit. So I know in the States here, there's a lot more planned out, and there's a lot of like surgical assistants that come in and assist. I guess that's probably not the case. You're one-on-one with that patient in these situations.
Depends on the staff that comes at the time. Sometimes it's just bare minimum staff that comes, and sometimes we have excess. People really volunteer, and we'll have multiple nurses, and we have more than one per room, and we can have scrubs that come and assists that come. So it just kind of depends on the situation.
What's the the youngest child that you've done any kind of orthopedic surgery on?
So, I've done them down to less than 1 year old.
Really?
There's some, and even at these trips, there's kids that come in with birth defects, like a club foot or something like that we have to release, put in a cast to try and straighten them back out so that they can have a normal development past that.
Yeah. So that's tiny. That's
Very
cool.
small.
Yeah. And that's something that they're born with, like a cleft foot. So it's.
Yes.
I've actually never heard that. I've heard of the cleft lip, but
Yeah.
so
Club foot.
Club foot.
Yeah.
Okay.
It's just it's a spasticity in the muscles and ligaments or tendons of the ankle that cause it to internally rotate and get stuck that way.
Okay.
So it can be a big problem if people don't get that fixed. They walk on the side of their feet for their whole life.
Oh. Yeah, and it's usually something done at a very young age to correct. Okay, and it's not necessary. It is surgery and then put into the boot.
Sometimes it's put into try and realign in a cast if it's not severe. If it becomes more severe, then it's releases and then put them into a cast to hold it there while those tendons re-heal in a longer position.
Okay.
The problem is once they get to a certain age, the bones start to morph and change to that alignment.
Yeah.
And so then it becomes bony realignment procedures and much bigger surgeries to line that foot up right, and then the foot doesn't function quite properly.
I see. So yeah, very important to be addressed.
You hit it young.
Yeah, very early on. So I guess just in understanding, we've obviously done quite a bit of that, and it's wonderful to do. What is just some of your future plans? I know you're currently in a practice with one other doctor, and I guess kind of what's your five-year plan from this point forward?
I've been able to find my way back to the area that I grew up in Houston. I grew up along the I-10 area corridor, Memorial City to Heights area, and now I have a clinic in both. So I'm doing what I want to do.
Yeah.
It's just about growth and being able to help as many people as you can in that interim. So for me, it's about honing in on helping who I can in the process, but also honing in on kind of the ones that I have, the surgeries I have more interest in.
Yeah.
But in the end, I do so many different surgeries and at so many different levels, from kids down from 4 to people up to 80 years old where we're replacing joints. So for me, it's enjoyable to have all that exposure.
Yeah, it's very, very broad what you do. So if someone wanted to make an appointment, is it would they just basically call y'all's office to schedule?
Yep.
Okay.
Yep.
And what's the name of the practice?
So you can look it up on Google for me online. You just look my name, Justin Chronister, MD, and you kind of depend on where you're looking up from. It may give you both locations, or it may give you one location. Same phone number, so you call the same phone number and you can make an appointment.
And make an appointment. And is an appointment required, or I guess a referral from their primary care doctor, or they usually can call and make their appointment without that?
That depends on insurance, but if you called us because you're interested, then we could lead you in that direction.
And get that evaluation.
A lot of the insurances nowadays are HMOs, and they require a referral to come see a specialist, but a lot of them aren't.
Okay.
It just depends.
Awesome. Well, thank you so much for coming out and kind of talking to us and sharing your story. And thank you all for tuning in. And for any of you who are looking to see an orthopedic surgeon for whatever it might be related to, upper or lower extremity, you can look up Dr. Justin Chronister online, and you will be directed to one of his offices. So thanks for being here, and thank you all for tuning in. We'll be right here next week at 7:30.